All right. So, occupational therapy and sickle cell. So, we'll talk a little bit about what occupational therapy is, our scope of practice, how OTs can help out with those with sickle cell disease. I'm also doing some research, so if you all may want to participate in it, I'll let you know a little bit about it, and we can see where we go from there. And then a little summary of all that we've talked about today. Alrighty. So, a little introduction to occupational therapy. Um, a lot of people have had occupational therapy before, maybe if you've broken a leg, if you've ever ended up in the hospital, if you've had a stroke, just a little bit of everything. We work a little bit of everywhere and work with just about anyone. So, as practitioners, occupational therapists are focused on the tasks that are meaningful to the patient, to the client, and those things include the things that you might need to do, but also the things that you might want to do. So we help people across the lifespan from very, very little in the NICU to some of our older adults. We help those people participate in the activities meaningful to them through the therapeutic use of everyday activities, which we call occupations. Um, Occupations are not just limited to jobs. For occupational therapists, occupations include play, education, rest and sleep, health management, work, social participation, leisure, activities of daily living, and those include bathing, dressing, eating, and then instrumental activities of daily living. And those could include being a caregiver, driving, having a social life, anything like that. So our scope of practice, like I said before, we work with a little bit of everywhere and with a little bit of everyone. So some common conditions we might see, we might work with people with autism or on the spectrum. We might work with people who have had a hip replacement. We might work with people who have been in the ICU in a coma and have woken up. We might work with people with hand injuries. We're really just all over the place. We, again, work with anyone. Um, so some ways we can help include helping with activities of daily living, such as bathing, dressing, and eating. So if you get into an accident or you hurt yourself in some way, you may have to relearn how to bathe yourself, how to dress yourself. For example, if you've had a stroke, maybe your left side doesn't work as well as your right side. We may train your left side to work again, or accommodate you so that you can learn how to use your left side in a different way to bathe or dress yourself. We may also recommend adaptive equipment like shower chairs, long handled shoe horns, sock aids, um, built up handles on spoons and forks. These things try to help make your daily tasks easier if you have had an accident or something that is keeping you from being able to perform it in the way that you used to. We also perform caregiver and family training. So if you've just got a diagnosis, we may go in and give you a little more education on the diagnosis and how things may change for you. If, say, you have to use a walker now or a wheelchair, or you need some of those adaptive equipment, we may show you how to use them and teach your family how to help you into those things and out of them. We assist with creating routines and following them, transitioning back to work, school, and leisure activities. We may also work with cognition and executive functioning and memory. We provide education on coping strategies, conflict resolution, falls prevention, home safety, accessibility, medication management. And we also work within the realm of research as well. So sometimes we work on current healthcare procedures to maintain and improve quality of life. Some of our fields of practice, we work in healthcare fields. So, hospitals, so that could be in acute care where you're there for just a little while, inpatient rehab, children's hospitals, skilled nursing facilities, psychiatric hospitals and programs. We work in outpatient clinics. We work in home and community health. That includes school systems, home health, community clinics, and homeless shelters. We also work with private organizations, private practices, corporations, and within travel OT. So like I said, we work a little bit of everywhere. And this isn't even an exhaustive list. This is just some of the ones that I could think of off the top of my head. But we work everywhere. We typically work within orthopedics, physical injuries. We work in vision. We work in pediatrics within the school system. We work in mental health. So you might see an OT pretty much anywhere. So a little bit about the process of obtaining an occupational therapist or getting occupational therapy services. You would have to get a referral. Usually you would talk to your doctor or healthcare professional to see if they think OT can be helpful to you, or they might order occupational therapy services for you if they think that will be helpful to you. We'll start with an evaluation. We'll get to know you, your story, the barriers that are keeping you from performing your occupations optimally and efficiently. And we'll create goals with you to work toward. And then we'll start making interventions. So using what we've learned about you, your client factors, your social, cultural, all your factors, we'll put activities and strategies in place to work towards client-based goals. So really occupational therapists they work with the client a lot. So we want to make sure that we're hitting what you want, but also we're meeting those goals and helping you to progress. So after intervention, we'll continue to reevaluate you and we'll see how you've grown and where you need to go to reach those goals. And then eventually you'll be discharged. And that's once your goals are met, you'll be discharged if there are no further issues that need to be addressed. And here are some occupational therapists in action. On the left is an occupational therapist working in the hospital. In the middle, it's an occupational therapist working in mental health. On the bottom middle, so we're working on fine motor. And then on the right, it's an occupational therapist working with the baby, working on building those fine motor and grasping skills for future use. Alrighty. Now we're going to talk about occupational therapy interventions in sickle cell disease. So this is something that's really interesting to me, and I know that a lot of occupational therapists some occupational therapists get the opportunity to work with those with sickle cell disease, and some of them don't. I also know that there is a greater need for occupational therapists and to work with those with sickle cell disease. And also there's a great need for education, I feel like, with a lot of our healthcare professionals, because I feel like a lot of healthcare professionals don't really know what sickle cell disease is. And they don't really know how to work with patients with sickle cell or to even advocate for them in any way. And I feel like occupational therapists can be really big advocates for people with sickle cell disease and help in a lot of ways. And I'm just going to talk about a few of the ways. This is not exhaustive, but these are just a few of the ways that I've learned through schooling. So we work a lot with acute and chronic pain. So managing that pain allows for greater participation in occupation. And warriors may face decreased participation in occupations such as school, work, activities of daily living. Like the pain might be so intense, you just don't want to do anything. It might be hard for you to bathe. It might be hard for you to get dressed in the morning, and even participating in leisure activities. Some of our interventions include modalities such as heat or cold, just to take the ache off. We also teach safe body mechanics and ergonomics. So if you have a chronic pain, maybe we can teach you how to work your body in a way that won't cause you more pain in the future. We also teach energy conservation training. So if you know you're really fatigued, we want you to participate as well as you can, but also participate smarter, not harder. So we want you to, do the smaller tasks first, the things that aren't going to take the most out of you. And then, plan it so that if you can, you do a bigger task. And then if it's too much taken out of you, you plan for the next day or later in the day. We also provide education or training in communication skills. This can be more for like your social. So especially for like a lot of adolescents or kids, you kind of want to be seen as, just like all the other kids, but it's hard for you because you are dealing with a disease such as sickle cell. So we kind of help to teach you to say no if you need to, and to listen to your body, and work through the emotions that come with that. And we also teach some relaxation techniques for the times that the pain is really bad, or it just seems like it won't go away. We try to teach some relaxation techniques to kind of help to come down just a little bit. We also work in schools. So we have some school-based interventions. Many adolescents with sickle cell miss school due to health and pain complications, and school-based OTs are uniquely positioned to recommend adequate accommodations for these individuals. Um, and school-based OTs can be some of the biggest advocates for those with sickle cell disease in schools. Some recommendations via 504 could include allowing more frequent hydration and bathroom breaks, rest breaks to avoid fatiguing, avoidance of extreme temperatures, and then also inclusive social and interpersonal activities, like I mentioned before. For adolescents and children with sickle cell disease, it can be a little bit isolating, or people might look at you a little differently. So we try to recommend more interpersonal activities so they can get to know you and get to build a bigger social circle. And then finally, some mental health interventions. Managing on a day-to-day basis can cause increased stress, anxiety, depression, feelings of isolation, and take an overall large emotional toll on caregivers and warriors. So OTs can look at these factors and how they affect occupational participation and address them holistically. Some of our interventions can include coping skill training. So we just teach you how to deal with that stress in different ways. We also try to deal with stress reduction, or if you know that the stress is unavoidable, we might teach you how to deal with that stress in a better way. We also teach mindfulness, meditation, and relaxation techniques. So really ways to just focus on your inner self, and can kind of control your mental when you can't always control your physical. So those were just a few of sickle cell interventions that OTs could participate in. I've also heard of occupational therapists wanting to participate more in transition programs, especially with adolescents, teaching them how to manage their own health and kind of move on from being a child and, having your parent or your caregiver take care of you in that way. And also then moving them to take more responsibility for their own health as they become older, and, making those phone calls to the doctors, and, managing your medication. Sorry, I had a little lapse of brain there, but managing your medications, and even just going to doctor's appointments, making those schedules, that kind of thing. So we're winding down now. As a part of my capstone project with my program at school, I will be conducting a research study, and I would love if any caregivers or warriors would want to participate. The title of my study is Sickle Cell's Effect on Occupational Participation, What Occupational Therapists Need to Know and How to Advocate for and Amplify Patient Voice. So I'm really looking into learning more about warrior stories and how their experiences with pain may affect their occupational participation, and also how their experiences with healthcare professionals could be improved, or how they have been in general. Participating in my study, if you participate in at least one interview, you'll be given an Amazon e-gift card. You'll just have to participate in one of the two interviews, and then there'll be Zoom interviews. And I plan to use this research to kind of call occupational therapists and healthcare professionals to action, and to provide a better experience for those who have had bad healthcare experiences. If you guys have any questions? or
How do you
anything
join?
else?
How do you join for your study?
Okay, I have a Google form that I'll drop in the chat, and it'll have the consent form. It'll give you a lot more information about my study, what I plan on doing. And then at the bottom, you would just sign, give me your email, your and the date and some other information, and then you'll be included in the study.
Okay, thank you.
Thank you.
I have a question.
Yes, ma'am.
First of all, okay, so the question for Leanna is, are patients able to be referred to occupational therapists by their primary care doctor, or can they reach out to an occupational therapist without referral?
So a patient would need a referral from their primary care physician. Usually you just go and, talk to them about what you may be experiencing that you think you need occupational therapy for. And then they'll give you a referral to come to an office. So.
Okay. And do you know if, my second question, sorry. Do you know if this is something that is typically covered by insurance, or would this be considered, because for example, I know one time I received a referral for physical therapy, but physical therapy was kind of considered for what I was getting it for, it was kind of considered a luxury. And so it wasn't covered at the rate that something else would be covered at. So are you familiar with what insurance companies cover for occupational therapy services?
I don't know for sure, so I don't want to give you a wrong answer, but I do know that it kind of depends on what you're being seen for, and what insurance will cover, and it probably also depends on what your insurance is. But I'll talk to some of my professors and some of the occupational therapists that I know and see if I can get you a good answer for that.
Okay, thank you.
Mm-hmm. Yes, ma'am.
Okay, my question is, when you're looking for an occupational therapist, what would you look for in them if you have sickle cell? Like, how would you know if they would be a good fit as an occupational therapy for a sickle cell patient?
That is a great question. I would think first, you can you kind of have to. I know that not all the occupational therapists in the world know about sickle cell disease, but I would look for an occupational therapist who is willing to listen, and who is willing to kind of learn more about your situation and your symptoms and kind of work with you on that. I know that not all occupational therapists are for everybody, but I think I would start there. Like you kind of can tell when people care about what you're going through, and you can ask them even at evaluation, like if they think this is going to be a good fit, or if they think that you should see somebody else. I've seen that a lot of times in evaluations. And a lot of times occupational therapists will tell you whether or not, the situation will work. But I would look for someone who's really going to listen to what you have to say, and what you're going through. Someone who's empathetic, and who feels like they can handle maybe the challenge of somebody who has sickle cell disease.
Okay, thank you.
Mm-hmm.
And on the insurance question, I know Medicare covers occupational therapy. And Pam, or someone, Mikhaili, had hip surgery. So my youngest son had some extensive hip surgery due to AVN. Our insurance did cover both physical therapy and occupational therapy. Because the physical, and that's where I first kind of came across, because I think sometimes I would conflate physical therapy with occupational therapy, and that was when I learned, because that was helping him how to get into the bath, because he was coming off a hip surgery and stuff like that. So, but I think that's a good answer, that nowadays, as we probably all know, if you have seen one insurance plan, you've seen one insurance plan, right? So just, you have to really check that. But Yeah. So do you get that question a lot, Leanna, like the difference between occupational therapy and physical therapy?
Yes. I get that question all the time.
Yeah.
And the way I like to look at it, physical therapists, they work a lot with gait, they work a lot with walking, your balance, that kind of thing. And we actually work together all the time. So, physical therapists and occupational therapists, you can catch us together in the same room performing a co treatment at any given time. But physical therapists will help you get there. Occupational therapists are going to help you do the things that you need to do when you get there. So, if say you're in the hospital, you've gotten a hip replacement, physical therapists are going to help you, stand up, figure out your balance, walk. But occupational therapists, when you start walking, when you get into the bathroom, we're going to work on your balance. We're going to work on having you be able to, feel confident enough in your legs so that you can stand there and brush your teeth, or you can stand in the shower or be seated in the shower and wash your body. So we work together in that regard, but I get that question quite a bit. All right. Does anyone else have any questions?
So would you suggest that sickle cell patients and their advocates actually maybe ask for occupational therapy? Because sometimes I don't know if it's offered, you're coming out to the hospital stuff, and a lot of times you may be offered PT, but is that something you would suggest that we actually ask for so that to see if it's something that would be beneficial?
I would recommend it because I feel like personally it couldn't hurt, especially if you feel like there is something keeping you from performing your best every day, or if you feel like the pain is too much or anything like that. I think it would be a good recommendation to just ask and see if the occupational therapist could come see you, and then perform an evaluation, and then they could decide whether their services are needed or not.
Thank you.
And how would an occupational therapy, you touched on like mental health and stress. So what type of things would an occupational therapy do with someone in that situation?
In mental health.
Yes.
So it just depends on first your setting, but we teach a lot of coping skill strategies. We teach a lot of stress management. We do a lot of practicing social situations and relaxation techniques. So say you were coming in, you're feeling anxious about maybe going to the doctor, or you're feeling anxious because you've had a bad experience with someone in the healthcare field, and you don't want to have an experience like that again. We could teach you, kind of grounding techniques for when you're starting to feel that anxiety, teach you to kind of notice when that anxiety is coming. And also, we could do a lot of occupational therapists like to do role play. I I like doing that too, especially for younger clients, where you kind of practice what you may say in a social setting, and it takes away a lot of the stress and the anxiety that comes with that. So you may practice speaking with a healthcare professional, and we have like assertiveness groups as well, where you can practice, this is what I need, and I need you to give it to me, and it'll take away a lot of the stress and anxiety that comes with those types of situations.
Okay, and the reason why I asked that question is because not all therapists um does that. So
Mhm.
that's why I asked the question about how does the occupational therapy, how does that fall, mental health fall underneath of them? And that was a good question because not all of your therapists, they don't practice that with you. And sometimes, having sickle cell is a very stressful thing, and they need to know that, especially when they're switching from adolescence to adult. It's
Mhm.
very important because that's a big changeover. So thank you.
Thank you. Mhm. Any more questions before I stop sharing?